This is Jacob Ridenhour's SBAR bedside shift change report. My patient, his initials is JM. His room is 10406. He's a 63-year-old male. Admitting diagnosis was a sacral ulcer limited to skin breakdown, and it was a deep tissue injury. Admission date was January 27th, 2025. His symptoms included mild redness at the sacral ulcer site, diminished lung sounds, persistent cough with moderate mucus production. The situation, JM was admitted due to a sacral ulcer with deep tissue injury, likely due to prolonged immobility following a traumatic T4 cervical spine injury sustained in a motor vehicle accident he had in 2023. Due to his limited mobility, he is highly susceptible to pressure injuries, and his wife noted this during his home care and decided to call it in. He is currently on contact precautions due to possible multi-drug resistant organism of his deep tissue injury slash pressure ulcer on his sacral site. Persistent symptoms include diminished lung sounds, rales, and productive cough with moderate clear mucus secretions. He has been non-compliant with his BiPAP due to his fear of not being able to remove the mask while he is asleep due to his weakness of his upper extremities. The background is a past medical history of primary hypertension, coronary artery disease, anxiety and depression, chronic suprapubic catheter or neurogenic bladder, hospital-acquired pneumonia from December 6th to December 19th of 2025, type 2 diabetes, which is currently unmonitored, a neurogenic bowel with a neuromodular implant. He has allergies to poison ivy extract. He's a code status DNR, limited to SOTO, with advanced directives on file. Social history, he lives with his wife who resides several hours away, and he has limited family support. His only child is his daughter, which is currently in the Navy, so neither of them are around very often. Assessment, vital signs are usually stable, around 99 degrees Fahrenheit. Heart rate is around 70 beats per minute normally. Blood pressure stays pretty elevated at 140 over 50 or 140 over 60s. Excuse me. Respiratory rate stays around 14 breaths per minute with diminished lung sounds and rales noted throughout. And his oxygen saturation is at 95% on room air. For his respiratory assessment, a persistent cough with moderate semi-clear mucus production, diminished breath sounds with rales, as stated before, and he's non-compliant with his BiPAP therapy due to being scared of not being able to remove the mask, which is totally valid, and respiratory therapy should be notified. Cardiovascular assessment, normal sinus rhythm, and he has diminished lower extremity pulses, and they are cold to the touch due to his due to being paralyzed from the waist down. And he has +1 edema bilaterally below his knees. For his integumentary assessment, a sacral ulcer, mostly healed but with mild redness. Early skin breakdown on genitalia due to chronic male Purewick catheter, so that should be monitored. Neurologic, he is ORI ANO times 4, Glasgow Coma scale of 15, cognitive function is completely intact despite motor impairment from T4 spine injury. Musculoskeletal segment, he is severely compromised and cannot get out of bed. He has limited motor function in upper extremities, but is able to do most tasks himself and should be also encouraged to do so. Genitourinary, as stated before, he has a neurogenic bladder managed with a suprapubic catheter. Regular output of clear straw-colored urine. Gastrointestinal neurogenic bowel with a neuromodulator. His abdominal is soft, non-tender, and slightly distended. Regular bowel movements, but incontinence is a concern. Psychosocial, he shows some signs of depression and anxiety due to being mostly alone and also to just having a life-changing event in general. His blood glucose does stay moderately elevated due to his type 2 diabetes that is unmonitored. And his white blood cell count has been pretty elevated recently, and should be monitored for a infection that has came back, possibly. It went down and then now it's on the way back up, so that trend should be monitored. He has a Braden score of 13, indicating a moderate risk for skin breakdown, and he has a fall risk that indicates a high fall risk with a 45-point Morse fall scale. I recommend wound care. So continue addressing changes for his sacral wound to ensure that it is healing properly and document on it properly as well. Respiratory care about his non-compliance to BiPAP. This needs to be talked about, something that we could possibly do, maybe instance of spirometry, breathing exercises, etc., for his just altered respiratory status and his non-compliance with his BiPAP. So circulatory monitoring due to his lower extremity perfusion being decreased, leg elevation, compression if appropriate, medication management, just monitor the side effects of his anticoagulant, and possible need for diabetic management due to his elevated blood sugar that's not being monitored. He should be repositioned every few hours to maintain skin integrity, and also moisture barriers can be used. Psychosocial support, so I believe he should have some consultations as far as his mental health is concerned, as he does seem to be showing some moderate signs of anxiety and depression due to being alone and also having a life-altering event taking place in the past few years. And discharge planning should be notified, physical therapy, occupational therapy, case management, wound care teams, etc. Also arrange home health care services. His wife is the one who was currently taking care of him, and they're not sure exactly what needs to happen with that yet. And also he needs to be educated on any follow-up that needs to be done with cardiology, physical therapy, etc. And that is my SBAR for this gentleman. And thank you so much.